Hi, everybody. Welcome. We'll get started in just a few moments. We're going to give everyone a chance to log on. Good morning, everybody. We will get started in just a couple of minutes. We're going to give everyone an opportunity to log on. We have a large audience joining us today. Welcome. I'm Jen Covich Bordenick from the eHealth Initiative. Delighted you could join us here today. We'll get started in just a moment. Hi, everybody. Welcome. Good morning. We'll get started in just a minute. We're going to give folks an opportunity to log on. Welcome to the summit. Good morning, everyone. We will get started in just a moment. We are going to give people an opportunity to log on. Thanks for joining us this morning for the Digital Health Equity Summit. We know we are using a new platform this morning, so we expect there will be a few questions. If you do have questions or any technical challenges, feel free to go in the chat or email us at info@ehighDC.org and we will help you out. We are on a new platform today, so welcome. Delighted that you could join us here this morning. Beautiful day here in Washington, DC, so great to have everybody here. Good morning. Welcome. Thanks for joining us for the Digital Health Equity Summit. Going to give it just another minute for people to join. Welcome. Good morning. Welcome to the Digital Health Equity Summit. I'm Jen Covich Bordenick. If you're just joining us, we will get started in just a minute. We're waiting for folks to log on. We've got a large audience today. Thanks for joining us. Normally at this time, we'd be asking folks to tell us where you're logging in from. So if you do want to go in the chat box and tell us where you're logging in from across the country, we'd love to see where our audience is joining us from. So let us know where you are. Welcome, North Carolina. Great to see you. Wisconsin, we love it when you join us. Welcome. Delaware, great. New York, Massachusetts, a lot of California. Thanks for getting up early with us here. Marylanders, love to see my neighbors here. Welcome everybody. Kentucky, great to have you here. Got a lot of East Coasters, a couple of West Coasters, welcome. Where are my international folks? We've got our Dubai contingency and our Canadian contingency. You guys here today with us, welcome. Seattle, welcome. Great to see you, welcome. All right, North Carolina is definitely represented today. Welcome. Wonder if we have any baseball fans out there. Welcome St. Louis, Atlanta. Great to see you. All right. Go Braves. Welcome everybody. Welcome. Okay. Great, well, keep letting us know where you are logging in from. We do want to know where our audience is, and we are interested in your feedback throughout the program today and tomorrow. So please give us feedback through the chat, questions, etc. We want to hear from you. And I'm going to go ahead and get started. We've got a few things that we want to make sure that we get through here today. So Catherine, if we could, we can pull that slide down. That's great. Great, thank you. Okay, well, welcome. Good morning, everybody. I'm Jen Covich Bordenick, the proud CEO of the eHealth Initiative, EHI, and I would like to welcome you to the first Digital Health Equity Summit. Our focus, addressing inequities and building a modern healthcare system. We're delighted to be joining you live. We're actually in our offices today. Beautiful day here in the nation's capital, Washington, D.C. And we're here today to address what I believe is the most pressing issue in healthcare. How do we build a healthcare system that works for everybody? A system where everyone has an opportunity to obtain their highest level of health. Our organization, EHI, is a catalyst for healthcare transformation, and each year we convene hundreds of leaders and healthcare professionals in small sessions to discuss how do we unlock opportunities for change. And as an organization, we believe that innovation and diverse perspectives really power this transformation in healthcare. And we also believe, actually, I think we know, that this current system is not an equitable one. Each year we identify innovative tools, best practices, new apps, remote monitoring, virtual care, all kinds of neat things out there in healthcare that are improving care. Yet we know that many of these digital tools remain out of reach for many in our society. But our vision is that as an organization, we can create a system that's lower cost, higher quality, and accessible for all populations. Now, we all lived through the last 20 months, and I think when COVID first hit, you heard a lot about COVID being the great equalizer. Remember, it didn't matter who you were, nobody had immunity to COVID, we were all at risk if you were rich, poor, red, blue, black, white, but this wasn't true in the end. And I think the inequity of the healthcare system, COVID, put all of the healthcare system's dirty laundry out there in the open for everyone to see. The inequity, the loss, the sickness, death, treatment, care, all of this was exposed for everyone to see. And we could watch night after night, the numbers climbing, week after week, month after month. It wasn't equitable. And while surprising for many around the country, this was not a great surprise to most executives and healthcare professionals. Professionals both in the private and the public sectors. The inequities have been there a long time. And there are plenty of fingers to point, lots of guilt, shame, blame to go around. But more importantly, there are many solutions that can be applied to these vulnerable populations. because COVID also demonstrated to us the power of technology and the power of actionable information. We witnessed how virtual care solutions could bridge the barriers of distance for marginalized communities, how digital tools could help combat affordability, accessibility. And we saw how analytics could target at-risk groups. So that's really what the next 2 days are about, the promise of applying these digital solutions to address these challenges. Now, when EHI started working on social determinants of health 4 years ago, SDOH was not a top priority for many organizations. But just 2 weeks ago, we sent out a survey asking our executives and professionals, what's the top priority in your organization right now? And across the board, health equity and social determinants of health was at the top of that list. So we've got everyone's attention now. So this conference, the summit, over the next 2 days, you're going to hear from over 50 speakers from hospitals, health centers, public health, vendors, payers, every stakeholder you could imagine. Today, specifically, we're going to hear about solutions for rural healthcare, effective strategies for FQHCs, how to use telehealth to expand maternal health, venture capital, how we can get money into the system, and reimbursement. Just a few of the topics we'll cover today. The goal is to listen, learn, and share with each other. And this is EHI. So of course we have every chat feature, every LinkedIn group, our new Whova application and platform that you're on right now. We want you to engage with us. I want to encourage you to engage with the speakers by providing your comments, ask the uncomfortable questions. We welcome all of your feedback. The bottom line is that we need to do better as executives, as parents, and as human beings. We need to look around the country, look around our organizations, our neighborhoods, look around the room with an equitable lens in which all races, ethnicities, creeds, genders, geographies have access to care. And as healthcare leaders and professionals, we have a responsibility to make the investments to push the changes needed, change the rules, empower the individuals, make hard calls, and yes, support the efforts. And this is not going to be easy. But if you're interested in carving a path forward to a system that we can be proud of, then I want to welcome you to the program today. I think you're going to be pleased with what you see. Before I get started, I do want to thank the sponsors of today's program. If we could just bring up that slide for a moment. EHI is a small nonprofit, 20 years strong, but as a nonprofit, we rely upon the generosity and contributions from many organizations. And these organizations listed here today recognize the importance of these issues and are sponsoring today's event. And also happen to be actively engaged in some of the most innovative projects out there right now, helping vulnerable communities across the country. Thanks. I also want to give a shout out to our tremendous staff who've been working diligently to prepare for this event today, particularly Juane Dixon, who leads our SDOH work, and Catherine Pugh, who heads our policy work. Both have put a tremendous amount of work and thought and time in today's program. The entire team EHI has been working hard to bring you the best and the brightest in the field. So please join me in recognizing their hard work. Finally, a couple of housekeeping items. As I mentioned, we could bring up the housekeeping slide, that'd be great. We are on a new platform today, Whova, and we expect that there will definitely be a few glitches. We've got 1,500 registrants, simultaneous running panels, dozens of speakers, so please be patient with us. I encourage you to look through the agenda on the side of your screen. If you want to receive an alert about a session, click Add to My Agenda next to that session that you'd like to go to. After Dr. McIver's presentation this morning, you're going to see a pop-up box, join next session. Every time a session ends, you'll see that pop-up box, and you can just click on that and it will take you to the next session. If you do decide to leave us today, that's fine. We appreciate it. We'd love to have you back. Come back later, no problem, but you will have to log in again. The whole system is pretty intuitive, but if you have any issues, feel free to chat with us or email us at info@ehidc.org. Great, thanks. And now I am really delighted to introduce our first speaker, Dr. LaShawn McIver. Dr. McIver is with Centers for Medicaid, CMS, as the Director of the Office of Minority Health. She's a proven public health leader with experience in driving successful health initiatives and public policy efforts aimed at promoting health equity, improving outcomes, increasing access to care. Before joining CMS, she spent 9 years at the American Diabetes Association. She's also served as the inaugural HIV/AIDS Fellow for the Congressional Black Caucus Center for Policy Analysis and Research, and as a program director at the Baltimore City Health Department. Welcome, Dr. McIver. Delighted to have you today.
Good morning to everyone, and thank you so much for that warm welcome and for the invitation to be here today. As noted, my name is Dr. LaShawn McIver. I'm the director of the Centers for Medicare and Medicaid Services Office of Minority Health, also referred to as CMS OMH. It is my pleasure to serve as the opening keynote for this important gathering today. This event is timely. This event represents the forward thinking needed to make advancements in digital health and health equity. And those gathered here together for this event represent the diversity of thought that is needed to continue driving innovation in this area. Like many of you here, and as Jennifer just spoke about, I am certain the last year and a half has been an incredible journey during this time of disruption due to the COVID-19 pandemic. As a physician working in public health, it has been challenging to see the hardships of communities disproportionately impacted by COVID, experiencing more severe health outcomes, and facing unimaginable challenges. In the midst of this, the Office of Minority Health at CMS, we marked our 10th anniversary last year. And although we had many things to celebrate, COVID-19 reminded us that there is so much more work to be done in achieving health equity in healthcare. However, during this time of disruption, we also witness innovative solutions emerging across the healthcare ecosystem, which I'm sure many of you also witnessed as well in response to this public health emergency, demanding a renewed national call to action for all of us. Against this backdrop, our office began looking to this new decade, recognizing in order for us to collectively move the health equity needle, we must all work together to achieve it. Digital health tools became a central focal point to closing gaps during this time. And although they serve as an important part of this complex healthcare equation, they represent the great promise in their ability to close gaps in care. So I am delighted to be the first speaker today to jumpstart this important conversation. Next slide, please. In my presentation, I will be providing an overview of CMS's Office of Minority Health. I will then describe some of the critical executive orders issued by the President related to health equity, and I will discuss telehealth resources provided by CMS and share some of the work CMS is doing to impact the social determinants of health. And lastly, I'll share with you some of CMS's resources and programs that may serve as valuable tools as you consider digital healthcare and equity. Next slide. Next slide. All right, well, I'll start with an overview of our office. The CMS Office of Minority Health was established under the Affordable Care Act 10 years ago. And we work across CMS's programs and focusing on CMS's policies. This work has always been important, and the Affordable Care Act formally recognizes its importance in establishing our office and other offices of minority health across HHS, as you can see on this slide. Next slide. From our inception 10 years ago, we have held the mission and vision you see here as central to our work. Our mission is to lead the advancement and integration of health equity in the development, evaluation, and implementation of CMS's policies, programs, and partnerships. Our vision is to see those served by CMS have achieved their highest level of health and well-being, and we have eliminated disparities in healthcare quality and access. Next slide. So our role within CMS, our office serves as the principal advisor and coordinator to the agency for the special needs of minority and disadvantaged populations. And our responsibilities include providing leadership, vision, and direction to address CMS minority health and health disparities goals. We participate in the formulation of CMS's goals, policies, and strategies. We implement activities to monitor CMS's health equity programs and share resources. In addition, we consult with federal agencies and other external organizations to address health equity, many of whom are gathered here today. Next slide. On this slide, you'll see the distinct populations that we serve. So when we say the Office of Minority Health, we're focused on racial and ethnic minorities, people with disabilities, members of the lesbian, gay, bisexual, transgender, and queer community, individuals with limited English proficiency, rural populations, and persons otherwise adversely affected by persistent poverty or inequality. Next slide. At CMS, as our staff work to embed equity into our programs, policies, and operations, I continuously encourage our agency to think about the real people behind our programs. I would encourage you all today to do the same as you think about the individuals who use digital health tools. For CMS, whether we mean someone covered by Medicare, a marketplace plan, any of the many state Medicaid and CHIP programs, a healthcare worker on the front lines, or a benefits counselor for a health plan, these are real people whose lives and experiences matter to us. We're working on behalf of the African-American mom and her son who has a disability in rural Tennessee, who both qualify for TennCare. We're working for the trans woman looking for an exchange plan in Alaska. We're working for the Middle Eastern woman and her nephew on CHIP in Detroit. And for the two daughters in Albuquerque, helping their mom translate information so she knows how to use her Medicare Advantage plan to help get supplemental benefits. We're working for that single adult in New Britain, Connecticut, who communicates with their healthcare provider in a video visit through American Sign Language interpreter. And for the woman in Santa Monica, California, who has a chronic mental health condition and unstable housing, but has stayed enrolled in Medi-Cal to make sure she can get ongoing treatment. So the list goes on. These images here just represent a few lives and stories, but these are real people with real lives. And as the largest insurer in the US, covering approximately 150 million people, our work, no matter where someone sits within CMS and what their daily job entails, it makes a difference to each of them. As an agency, we have important tools and levers to help make changes that impact each of these people, their families, their communities, to help them live their healthiest, best lives. So again, as you all continue throughout this summit, I urge you to keep at the forefront today exactly who we are all working for, all the many diverse communities and individuals we collectively support each day. Next slide. Our administrator, Chiquita Brooks LaShawn, recently shared CMS's strategic plan that centers the focus of our agency. Health equity is a central part of this framework. And as stated in the vision, CMS serves the public as a trusted partner and steward dedicated to advancing health equity, expanding coverage, and improving health outcomes. And we plan to enact this vision through the 6 pillars that you see here. As I noted, advancing equity is a central part of this plan. So we intend to advance health equity by addressing the health disparities that underlie our healthcare system. In addition, to build on the Affordable Care Act and expand access to quality, affordable health coverage and care. Engage our partners and the communities we serve throughout the policymaking and implementation process. To drive innovation to tackle our healthcare system challenges and promote person-centered care. Protect our program's sustainability for future generations by serving as a responsible steward for public funds, and foster a positive and inclusive workplace for CMS that promotes excellence in all aspects of CMS's operations. Equity is not only a priority for our office, but is a strategic imperative in accomplishing our agency's mission. And our office is certainly honored to be a part of this work. Next slide. Next slide, please. Thank you. So what are we trying to achieve when we think about health equity? What I have learned over the last several years is that definitions matter. And so I thought I would start with how at CMS we are defining these terms and concepts. As we've looked at health equity and disparity-related definitions used in the field and across the government, we've sought to align our thinking at CMS to create a shared understanding and way of operationalizing health equity initiatives. Here you can see one definition of health equity drawn from Healthy People 2030. This definition centers on avoidable health differences between groups of people and acknowledges the collaborative efforts to address these avoidable inequities are a necessary part of working towards health equity. As noted in Jennifer's opening comments, she talked about COVID being the great equalizer. But as we began to pull back what was happening across the country, we saw that there were some communities that experienced it differently than others. Eliminating avoidable health differences necessitates acting to address social, economic, and environmental disadvantages that drive these differences and disproportionately burden minority and underserved groups, including the groups that I noted earlier served by our office. Next slide. As we think about defining health disparities, we also use the Healthy People 2030 definition of health disparity, which acknowledges these particular health differences. So for example, those linked with social, economic, or environmental disadvantage. Health disparities are health differences which require consideration and strategies to address the social, economic, and environmental causes of unjust health differences. This definition also acknowledges those groups that have systematically experienced more barriers to optimal health, including racial and ethnic minorities, sexual and gender minorities, individuals with disabilities, individuals with limited English proficiency, and individuals living in rural and remote communities. Next slide. And it is important to note that equity and equality are not the same. We use this graphic from the Robert Wood Johnson Foundation to help illustrate the difference between the concepts of equity versus equality. Equality is the top box. Everyone has the same resource, and in this case, it is a bicycle to travel with. However, as you can see, this one-size-fits-all bicycle does not necessarily help everyone participate here in this picture to go on a bike ride. The smaller individual has a bicycle that doesn't let them reach the seat, and they may not be able to ride. The taller individual is hunched over and can't fit on their bike, and they may not be able to ride. And the individual in the wheelchair is next to their bicycle and can't participate at all because their bike is not accessible. This difference in whether they can participate is a disparity between those who can travel on their way using the resource they have, which in this case is their bike, and those who cannot ride at all or can't ride easily as others. Equity is the bottom box. Everyone has what they need to participate fully in the race, traveling together using the tailored resource that they have, and in this case, the bicycle. The smaller individual has a smaller bike, the taller individual has a larger bike, and the individual in a wheelchair has a bike that is accessible to them. In this bottom picture, the disparity has been eliminated and each individual has no difference in their outcome. For CMS, a health disparity is the difference in healthcare access, quality, or outcomes between groups. And at CMS, we are seeking to assess and address health disparities among communities who have systematically experienced greater obstacles to health. For example, based on race or gender identity or language or disability status. I hope this information on how CMS is prioritizing equity and how we are conceptualizing health equity will be useful as you further explore the intersection of healthcare technology and health equity today. Next slide. I started with the focus on CMS Office of Minority Health, and then more broadly, how the entire agency is prioritizing health equity. Now I will extend the lens out one layer further to share what the president has charged the entire federal government as it relates to equity. In this section, I will discuss how the health equity related executive orders passed by the Biden-Harris administration have impacted the work of CMS OMH. Specifically, I will focus on Executive Order 13985, which is entitled Advancing Racial Equity and Support for Underserved Communities through the Federal Government, and Executive Order 13995, which is ensuring an equitable pandemic response and recovery. Next slide. In January of this year, President Biden called upon every federal agency to implement a comprehensive approach to advancing equity for all, including people of color and those who have been historically underserved and adversely affected by persistent poverty and inequality. Here on this slide is a summary of the executive order. It lays out a systemic approach to address inequities, and this includes embedding fairness within the decision-making process of all federal government agencies. And it also takes a very comprehensive approach to doing so. And it lays out in the executive order these underserved communities as those adversely affected by persistent poverty and inequality, the tribal community, people of color, and otherwise historically marginalized populations. This executive order underpins many of the activities underway within CMS that I have mentioned already, as we have taken steps to embed an equity lens in our agency's policies, programs, and operations as directed through these executive orders. Next slide. Another key executive order which addresses the disproportionate impact that the COVID-19 pandemic has had on communities of color and other populations that are medically underserved. We have multiple ongoing efforts that align with this executive order. Some of them are listed here. More importantly, we're listening to our stakeholders. We've conducted rounds of listening sessions. We've included some of the federal resources related to COVID-19 on vulnerable population webpage to assist our partners who are working in this area. We've released a new Covich to Care resource that offers tips on staying healthy and using Medicare marketplace plans for COVID-19 related coverage. And lastly, our support for data collection and outreach is a key area that we're involved in. We've also listed here some potential opportunities for equity, including providing additional support to other CMS components in federal agencies and becoming more involved in equity task force activities across the department. Next slide. So as we think about digital health tools, I would be remiss not to talk about the role of telehealth and some of the things that have been experienced by our beneficiaries and consumers over the last year as we have thought more critically about telehealth. So in this next section, I'll just briefly talk with you about what we've learned from our stakeholders, as well as some of the steps that have been taken related to telehealth. Next slide. Our office works to have consistent two-way engagement with our stakeholders, and we look to engage our partners regularly to share updates from CMS, but also to stay in touch about what our stakeholders have to share and what consumers are experiencing. So far, much of the feedback in recent months has surrounded the importance of data collection, including accurate, disaggregated, and shareable data. We also hear from our partners very consistently the importance of translated, accessible, and culturally linguistically appropriate resources and the need to continue this type of engagement. And we look forward to participating, working on these topics and hearing from our partners. I also want to share some specific digital health, specifics around digital health that we have heard. Currently, most of it is surrounding the digital divide and telehealth. One, on the effect of the digital divide in health, we've heard about the impact of the telehealth flexibilities and allowances, increasing access for some, but limiting access for others. In particular, the impact of having a lack of broadband in some areas of the country. Connecting community workers to provider electronic health records or portals to assist in care management and understanding care and results. Specifically related to telehealth, we've heard from stakeholders requests concerning continued telehealth flexibilities and what the future of that is for our beneficiaries and consumers. In addition, ways to address the digital divide in terms of access to broadband geographically, as well as affordability. Lastly, allowance of a third person for translations, caregiver assistance, and accessibility needs were items that we heard from our stakeholders of great importance. Next slide. So here is listed some of the resources that we have. In the next, I would say 2 to 3 minutes, I'm just going to briefly walk you through some of the resources we have. Specifically, I will take a moment to talk about the social determinants of health, and then I am looking forward to questions at the end. So next slide. These represent many of the tools that we've developed related to telehealth. The previous tool was related to providers. The second tool here is focused on our consumers. And we've developed resources for many of our populations as it relates to accessing telehealth services, many of whom were accessing them for the first time during this public health emergency. Next slide. Next slide. Thank you. So on this slide, this is where all of those resources can be found, And so as you're considering ways we could look into other digital systems, we are looking into other digital systems, including patient portals and how to use these items. If you have feedback or thoughts on that topic, we would welcome that at this address here, coveragetoCare@cms.hhs.gov. Next slide. So related to the social determinants of health, this is something that is central to the executive orders that I described as it relates is one of the issues most widely discussed today in health equity relating to the social determinants of health. So where people live, learn, work, and play, they affect a wide range of health and quality of life and outcomes for many individuals. Next slide. Our office is working around to ground the agency in the common understanding of the social determinants of health as established in Healthy People 2030 framework. I won't go into detail here about the definition, but only to say that we are very excited to see this work expanding throughout CMS, and we are using this framework to help drive our efforts. Next slide. One of the biggest challenges with understanding the drivers of disparities is the lack of SEOH data. And we know that demographics matter, but disparities can be caused or exacerbated by the social determinants of health. And so it is critically important to have data to help us understand more about the populations we serve and the barriers they face in accessing care. Next slide. Okay, I will do this in 1 minute. The little ding there is my timer, so I have to wrap things up, and I do want to just end with some final thoughts. So in these last few slides, I will give you a high-level overview of resources that our office provides that we hope can help you on your health equity journey. Next slide. This first resource is our Health Equity TA Assistance Program, and anyone can access this program. We provide personalized coaching and resources to help you embed equity into your strategic plans, resources on improving care for specific populations, guidance on data collection and analysis, as well as helping to develop language access plans and ensure an effective communication for those you serve. You can reach us for this assistance to this program at healthequityta@cms.hhs.gov. Next slide. In addition, on our website, you can take advantage of our disparities impact statement, And this is a tool that your organization can use to assist you in your equity work as well. It can be used to identify health disparities in priority populations, evaluate impacts of a program or policy, and create an action plan on how to implement sustainable actions. Next slide. I talked already briefly about some of our coverage to care resources. Again, these are tools that you can use to help populations that you serve as it relates to accessing care. Next slide. We have a sexual and gender minority clearinghouse designed to help improve the understanding of sexual and gender minority health disparities and provide information on healthcare access, health-related behaviors, chronic conditions, and the use of preventive services. Next slide. And the final resource that I will share is our Mapping Medicare Disparities tool. We developed this to address chronic conditions with an equity lens, and I encourage you to take a look at this tool as it provides a granular lens into chronic conditions by identifying areas of disparities between subgroups of Medicare and Medicare beneficiaries. Next slide, please. So with that, I will say thank you all for allowing me to join the discussion today. Before the questions and answer portion of this session begins, I'd like to share how you can connect to our office, and you can see all of the ways to connect with our office on the slide. But in closing, I will say that the pandemic has brought many of us together in new ways for the first time, and we have made progress in staying together, working to address the current crisis. But looking forward, our success will ultimately be measured by us, meaning collectively as a global healthcare ecosystem, work together in this next decade to truly create an equitable healthcare system. This public health crisis has brought underlying disparities and inequities in healthcare and coverage to the forefront that we have long known existed but have not fully addressed. There is much work to do as an agency, but CMS cannot do it alone. And as noted earlier, we must all work together to move health equity forward into the next decade. So my challenge to you all is, as you participate in this conference, think about, what can I do from my seat in the healthcare system to drive digital health equity? Are there barriers that I can remove for people who are underserved in our healthcare system? I look forward to working with you in the years to come as we collectively face the realities of where we are today, but more importantly, create a vision of where we will be in the years to come. Thank you so much.
Thank you so much, Dr. McIver. That was really inspiring. Really appreciate your comments today. I think we've got time maybe for 1 or 2 questions, if that's all right with you.
Absolutely. Thank you so much for having me.
Great, excellent. So you talked a lot about the pandemic as well, and I think that there's a lot of attention on these issues right now because of the pandemic. So what can we do to make sure that we don't lose focus now that, I hate to say, the pandemic's slowing down, but not as front and center as it was a year ago?
Well, I think we have to recognize that these challenges, as you said, we were sensitized to these challenges through the pandemic. And for people who have worked in health equity, we've known about these issues and have worked on them for decades. And we can't we can't undo what we have seen. And I think as leaders, I would encourage healthcare stakeholders to set goals within their organizations regarding health equity and really consider what are the ways that you can take the information that now. We all now know that disparities truly impact many communities in this country in devastating ways. So I would encourage stakeholders to embed it in their organization. I talked about the Disparities Impact Statement, which is a tool that we use to help provide support to us organizations to think about disparities and solutions. If you collect data, consider how you are using that data to analyze and examine inequities and to find solutions to address them. But more importantly, I think this moment has brought about conversations with new stakeholders who are now really finally starting to understand what this means for the healthcare system. And it represents an opportunity for great change in the future.
Great. And one more question. You know, we've got a number of different projects and programs in the private sector we're going to hear about over the next 2 days, and a lot of really great work going on right now. And I know for a lot of those folks, their question is, how can they work with CMS? How can they leverage partnerships? You know, what can they do with the government in partnership?
That's a great question. So, you know, our office prioritizes these two-way conversations that I talked about during my presentation. Our administrator has made it one of our key agency-wide priorities. So I would encourage your members, as they're thinking about issues that impact the communities that they serve, and as they see the policy work that's happening within the agency, that they, one, provide public comment, you know, talk to parts of the agency about challenges and experiences that they're having. We, for example, do hold listening sessions with our stakeholders so that we can hear, you know, if there are we have partner emails and listservs that people can participate in. So there are different ways to connect with the agency, but most importantly, I would say let your voice be heard and your concerns be heard, because our leadership is prioritizing our stakeholders' feedback as we think through these critical issues.
That's great. And if there's a specific individual or department, we would love to share that information with the audience today so that they can reach out. So we will share that.
Okay, thank you so much.
Thank you.
Thank you for having me.
And Dr. McIver, thank you so much for your time today. Really appreciate it. Wonderful. What a great way to start the morning off. All right, folks, here we go. So we're going to head into the next session now. What you'll see as the session ends is another session will pop up, and just click on the link that says join session. See you in the next room.